As of midnight last night, we had delivered 388,877 doses of the vaccine across New Zealand, an increase of 83,000 on this time last week. Within that, 120,000 people have now received their second doses, meaning that they will be receiving the maximum protection from COVID-19 through their vaccinations. Just yesterday, we delivered 14,000 doses nationally, and overall, we're tracking ahead of plan. I think Friday was our biggest day so far, with over 16,000 doses delivered in a single day. Based on these statistics, we're expecting to hit the 500,000 mark within the next fortnight. Within a number of DHBs, we're also seeing some really strong performances, and I want to acknowledge that and extend a special word of thanks to those. The figures that I've seen this morning that are also now being published, so you'll have access to them, include Bay of Plenty, Mid-Central, Capital and Coast, Hutt Valley and Southern, who are performing particularly strongly, so special thanks to the teams working there. My thanks go to the teams right up and down the country for the hard work that they are putting in. I know there are some very long hours going into the vaccination program, and it is delivering really good results. In Auckland, for example, Monday saw the opening of Auckland's fourth large community vaccination centre, with a site at Birkenhead Mall, joining the Mount Wellington, Highbrook and Henderson sites. All of those sites are capable of vaccinating up to 1,000 people in a day. On the same day, Auckland ticked over the 150,000 mark in terms of the total vaccinations delivered in the region. On Tuesday, Auckland's first primary care provider, Waiheke Medical Centre, began its COVID-19 vaccination program. They'll be delivering up to 90 vaccinations per day. Today, Auckland DHB's second Pacific-led site at the Westgate Shopping Centre in West Auckland has opened its doors. This site's being run in partnership with the Whanau Health Care and the Pacific Collective. They'll be vaccinating up to 300 people a day by appointment. The national online booking system is heading through its trials very well. Vaccination centres in Manarewa and Otara have been trialling it this week. They'll be followed by Kaikoura and Akaroa as well. The national online booking system will support and in some instances replace existing local DHB booking systems as we look to scale up to the broader population in the second half of the year. The platform that they are using for booking has been successfully used internationally, and the trials so far are suggesting it is working well. We're also making good progress in immunising staff and residents at aged residential care facilities around the country. Vaccinations are being offered at community vaccination centres. Mobile clinics have been working in some rest homes, and primary care practice has also been playing a role there too. Vaccination teams include a mixture of registered nurses from hospitals and the casual pool, community vaccinators and general practice, and of course pharmacy teams as well. Some DHBs have been contracting in providers to administer vaccinations on their behalf. At the same time as we highlight these good successes, I acknowledge that this is an evolving process, and we will continue to refine and improve systems as we go along, particularly in the logistics area. This is the biggest vaccination program that we have ever undertaken in New Zealand, and we're aiming to do it in record speed, record fast time. So I know that a number of people are working hard on that. I know in these early stages there will be some teething troubles. There'll be people who arrived to be vaccinated who might experience difficulties, particularly at some of those bigger centres where they are delivering vaccinations to thousands of people a day. And I want to reinforce one of the things, just a key message around what we're referring to as walk-ups. Our priority has to be for those who have made a booking, who are eligible and have made a booking. Where people are walking up to get a vaccination, we still do expect that that will be done broadly in line with the sequencing framework. So my message to people who are in group 4, which will be the last group to get underway, please refrain from walking up to a vaccination clinic at this point, because it can mean that people who have made a booking and who are eligible for a vaccination under the sequencing framework can miss out. So please, if you're in that group 4, please don't be attempting to walk up and try and get a vaccination at the moment. If you're, on the other hand, booked in, you're eligible, maybe you've missed your appointment for some reason, then yes, walk-ups can be an option, but as much as possible, if we can get people booking in first, then that will help us to avoid any issues where people miss out because of the congestion at vaccination centres. So I'll now hand over to the Director General for the latest case numbers and a brief update on Melbourne.
Thank you, Minister. Kia ora koutou katoa. Quick update on today's numbers. There are no new community cases in New Zealand since our last update, and there is one new COVID-19 case in managed isolation. Our total number of active cases today is 22, and the grand total of reported cases to date is 2,287. Crossing to the Melbourne community case that was reported yesterday by Australian health authorities. As we said in our statement last night, and this remains the case, our current assessment of the public health risk to New Zealand is that it is low. And at this stage, the Ministry is recommending that quarantine-free travel between New Zealand and the state of Victoria can continue with certain additional precautions in place. From what we know so far, based on the information from our Victorian health authorities, and we're in regular contact with our counterparts in Australia, the case is linked to the Australian border. That will be confirmed, we anticipate, by the whole genome sequencing, which we will be looking for the results of probably today. And there is a limited period when the person was considered infectious in the community in Melbourne, with a modest number of locations of interest. There are 12 listed on Victoria's Department of Health website as of this morning. Now, anyone who is in those locations of interest needs to follow the instructions of the local health authorities, and is also not able to travel to New Zealand for 14 days since that exposure. Likewise, anyone already in New Zealand who has been at one of those locations of interest during the time specified must self-isolate, call Healthline, and seek advice about being tested. There is a Section 70 notice in place that requires this to happen. Our contact tracing team at the Ministry will be following up via email around 4,500 passengers who have recently travelled from Victoria to New Zealand during the period that the Melbourne case was in the community and deemed to be infectious, which is since the 6th of May. And this afternoon, our public health team will join another call with Australian counterparts to get an update, and we expect to re-look at our risk assessment after that update, and also provide a further public update later today. Just some additional comments around vaccine. We're adding some further vaccine data to our website from today, and it will include information on the number of vaccines administered by each DHB, by ethnicity, including for Māori and Pacifica, and also an age and gender breakdown. This information will all be on a spreadsheet on the Ministry's website. We've also added information about the number of trained vaccinators, and I'm very pleased to say that that number has continued to increase, and particularly so over the last week or two. Now, not all trained vaccinators will be working as vaccinated on a given week. They may be have been trained in anticipation of being used through the next phases of the program, or indeed they may be rostered on leave or may not be rostered on that site today. There are sites opening and closing, and there are local DHB priorities and so on and so forth. A comment on adverse reactions from the vaccine, just a little bit of information about how those are monitored by MedSafe. Like all medicines, and indeed all vaccines, the Pfizer COVID-19 vaccine does cause side effects, and in some people these are mild and common and don't last long, and they don't stop those people from having a second dose or indeed going about their daily lives. But serious allergic reactions or serious events can occur, and those are particularly the ones that we record, that are reported to our Centre for Adverse Reactions Monitoring, or CARM, which works with MedSafe to monitor the safety of the COVID-19 vaccine, as well as all medicines and vaccines in New Zealand. So anyone who thinks they have had a reaction to the vaccine Of course, if they feel they need medical attention or advice, they should ring Healthline or talk with their GP, but they might also encourage them, I do encourage them to report their symptoms to CARM, C-A-R-M, that's the Centre for Adverse Reactions Monitoring. And after suspected adverse events, particularly those serious ones, all those reports are assessed by a medical assessor at CARM, and we also have in place an independent safety monitoring board that reviews any reports of concern from this monitoring. And it also reviews safety signals that come out from overseas reporting. For example, following the reporting around this increase in clots from the AstraZeneca and the Janssen vaccines, there was no evidence of this happening overseas related to the Pfizer vaccine, but our independent safety monitoring board did have a look at any reports that have been received here around possible clots and didn't find anything there. So they are doing ongoing work around that. And finally, for today, I'd like to acknowledge, given it is International Nurses Day, the importance and hard work, not just of all our health professionals in New Zealand, but particularly today, our nurses. A real shout out to them. They're often our first port of call when we need health advice, whether that's at the general practice, at a hospital or in community settings, or indeed aged residential care. Our nursing workforce is essentially our largest workforce, professional workforce. More than 61,000 nurses have an annual practicing certificate in New Zealand, and that number is increasing by around 2,000 per year. So to all the nurses out there, have a fantastic International Nurses Day. Hei mihi nui kia koutou katoa. Thank you very much to you all. Thanks, Minister.
Have you got any information on the number of people in Australia that have been in those locations of interest who are still having to quarantine in Australia and not come home for 14 days?
No, sorry, I don't. I'll just check if the Director General has any numbers on that.
No, I don't have specific numbers on that. What we do get reports on, and this will start to come through today from our Melbourne colleagues, is the number of people they've identified, either because people have volunteered or because they have used the app in Australia. They will have the number of people who they're categorising as casual or close contacts, depending on the nature of the exposure. And then we keep a close eye on what's happening with the testing of those people. When this happened with Sydney last week, there was no one who had travelled from Sydney to New Zealand, aside from the one person that the National Focal Point notified to us and who was in managed isolation down in Christchurch. There was no one else here in New Zealand who had been at one of those locations of interest. So we're not expecting any people, but of course we're just making sure we're following everybody up just to be sure they know what the information is.
I should have noted before we opened up for questions, we are under a slight time constraint today, so we need to wrap up about past, but we've got a bit of time for questions. So.
At all to these centres up north?
Ultimately, we want to get people vaccinated. We want people who are eligible to be vaccinated. Sometimes there are examples where people have to miss their appointments for an unforeseen reason. We don't want vaccines to go to waste either. So, walk-ups can be useful in that regard, in the sense that if people who are booked don't show up, then it means that we can provide vaccinations to people who have walked in instead. Right. So, it's largely an efficiency measure.
How chaotic is it getting up there?
Look, I think that we've seen some limited examples where there have been challenges, and there was a story just in the last 24 hours, which I think was very unfortunate, of an elderly woman who wasn't able to get vaccinated despite having made an appointment. Of course, we would like to avoid those sorts of things happening. I think all of those running these centres will learn from experiences like that. But I do want to acknowledge that these are early days. They're scaling up quickly. There will be the odd teething problem. If we all do what we can do to help them, then we can minimise some of that.
Do you think that the communications have contributed to a bit of confusion around who can go and get vaccinated now, and that has led to a bit of those challenges? You said last week you wanted to check the comms going out to DHB and GPs, and the general message has been group 3 is eligible since the start of May, so people are just going.
Yeah, so look, the sequencing framework talks about when groups start being able to get vaccines. It doesn't guarantee they're going to be able to get one exactly when they want to, and there are, as everybody wants one, which is great. Very reassured by the fact that there is high demand for vaccines, but we simply won't have the supply to be able to give them to everybody all at once. So the sequencing framework helps to manage demand, but it in itself is not going to completely answer that. We could have had a more granular system that would have been even more complicated. So in the end, yes, there is a bigger Group 3, or Tier 3, whatever we're calling it, is larger than the number of vaccines we're going to have available through to the end of June. So not everyone's going to get one straight away.
Do you think that has been communicated clearly enough, because people had an expectation that they could go and get vaccinated in Group 3 from the start of May, but that's actually not the resource that's available?
I mean, those who have been following along since when we announced the sequencing framework will know that that was something that we did stress when we announced the sequencing framework, that this is when groups start. And the ultimate determinant of when we finish is going to be availability of vaccines.
Should the DHBs be turning more people away then, if they just turn up?
Look, those are judgments for the DHBs and for those who are administering the vaccines. We've also said to them, please don't waste any vaccines either, because we want to make the best use of it. We also want to be sensible and pragmatic in the decision. So I know, for example, that some of the DHBs are now adopting more of a locality-based approach, particularly when dealing with small communities. That's very sensible. It's effective, it's efficient. They're probably going to get a higher rate of vaccination by going to a place once and doing it thoroughly than going back multiple times to try and target different groups. So it makes sense to do it that way.
The US is now...
I'll let you finish and then I'll come back to that.
Just looking too quickly at the gender breakdown. See, there's quite a big gap between men and women, with almost 100,000 more women being vaccinated.
It's probably a reflection of who we're targeting initially. So we're targeting the health sector workforce. The health sector workforce, there do tend to be more women in the frontline roles that are being vaccinated early relative to men. We also know that that has a significant impact on the ethnicity statistics there as well. So Māori and Pacific Island people are not as proportionately represented in those workforces as they are in the population as a whole. So as we get into Tier 3, I think we'll start to see those numbers more reflect the population at large.
The US has now approved the Pfizer vaccine for over 12, so are we likely to do the same anytime soon?
So there is a MedSafe process. I know that MedSafe have been looking very closely at what's happening internationally there. I'll ask Dr. Bloomfield for the latest.
Yes, so the approval in the US is initially an emergency use approval while it goes through a full approval process. MedSafe here is expecting the data from Pfizer from their trials at the end of this month, and then they'll quickly assess that. They're ready to go. But we are anticipating that may well be approved, and so we are starting to plan, our DHBs are starting to plan for later in the year to add on that 12 to 15 age group to our wider rollout as they become eligible, as the evidence, if the evidence supports that.
But the good news here is because we are expecting larger quantities of supply to start arriving from July onwards, when that group is added, we'll be able to add in an extra age cohort without that disrupting in any way the rollout of the vaccine to other people who are expecting it.
And what do you make of the High Court action today challenging the legality of the Pfizer approval?
Look, we followed a very thorough and rigorous process. It is the same process that very similar process to what is used for the flu vaccination and for other vaccinations used in New Zealand. We didn't use an emergency approval process. I'm absolutely confident in the process that we followed. I'm absolutely confident that this is a safe vaccine, that it is an effective vaccine, that New Zealanders are going to be much, much better off health-wise if we all take up the opportunity to get one. Ultimately, there's a limit to what, as a Member of Parliament, I can say about a court process that's active, but I'm very confident of our position.
On travel bubbles, you were warned in December that there was a growing legal risk in terms of human rights for New Zealand citizens not being able to return from places like Australia and UA where there was already quasi-agreements worked out, because the health risk was so negligible. So you couldn't really justify the clampdown on the human rights to return home with the health risk. Have you had any advice that suggests that there is ongoing risk with all the New Zealand citizens who are in other countries where COVID-19 is essentially vanquished as well? Or are you confident that you don't need to extend the bubble out? keep
The
out
only
risk?
the only New Zealanders who are having difficulty coming back to New Zealand at the moment are those who, so New Zealand citizens, I should say, are those who would be travelling from very high risk countries where we have additional restrictions in place. Now, if they are New Zealand citizens, they're still able to return from those places, but logistics are making that difficult. It's very difficult to get flights out of India at the moment. So while New Zealand citizens who are in India can come home, and we will accommodate them in managed isolation, I know that they're finding that very difficult. So we're monitoring that very closely. In terms of citizens and permanent residents in pretty much everywhere else in the world, other than those 4 countries, they can return home now. There is space available to them. The advice that we received at the time was that the limitation or the risk there was if people were having to wait, 6 months to get a space in managed isolation. That's not the case now. We've got about 20,000 rooms available over the next 3 months.
Your legal advice on that is generally privileged, so it's not able to relate some of the official information and or to the opposition. Are you at all open to avoiding that privilege so it can be part of the public discourse on this?
According to all convention and rules, that's a decision for the Attorney General. So it's the Attorney General who would waive any legal privilege on Crown law advice. But I can speak in broad terms. We have been very conscious of the fact that New Zealanders have a right to return back to New Zealand, when we had very high demand for managed isolation and people were waiting a long time to get a space in managed isolation, that was starting to push up against that right to return back to New Zealand. We're not in that position at the moment. There is a lot of rooms available, and there isn't a delay. People can jump online today, book a room to come home. So I guess what I would say is now is a good time for those New Zealand citizens who and permanent residents around the world who want to come back to New Zealand. Space is available. Take up the opportunity to come back. Ultimately, we don't want that space to sit there empty, so we're looking at other ways of filling that up, including potential other group allocations and so on. And it's possible that towards the end of the year, depending on how long we're having managed isolation in place for, that we'll see another seasonal demand towards the end of the year. So if you're a Kiwi desperate to get home, do it now.
This force is currently down globally, which is kind of the linchpin of the COVID immunisation register. Is there a backup system that you guys can use if Salesforce goes down, or is that kind of the system?
That's the system, and it's proven to be a very resilient system. I should say that occasionally when there are technical difficulties already and the system can't be used, for example, an internet connection issue, then there are backup manual systems that are used, and then the data are entered into the CIR subsequently.
On the trans-Tasman bubble, or cases in Australia, the ones that sort of fall short of when you suspend, it seems like you're putting a great deal of emphasis on these emails that go out to thousands of people, asking them to check their symptoms or whatever it is. Do you have any evidence that they're being read or they're going to the right place?
I guess what I'd say is we're treating a lot of what's happening on the other side of the Tasman in a very similar way to the way we would treat those types of cases in New Zealand if we saw them. So the case in Melbourne, a highly likely scenario there in terms of how the person came to be infected. They recently left a managed isolation facility. There's a potential there for there to have been some in-facility transmission. If that kind of case was to emerge in New Zealand, and it has previously, we would be first and foremost focusing on contact tracing our way out of that without the need for additional restrictions. That's exactly what they're focused on in Australia. The public health notice that the Director General has put in place provides an extra layer of protection for us as well, but we're broadly following the same kind of approach we would in New Zealand. In New Zealand, some of that will involve phone calls to people. Some of it, if they're relatively low risk, will just involve sending out emails using what contact information we have available. To compare it, say, to the QR codes, if a case of interest has gone somewhere and we then discover that they could have been infectious during that time.
Home. Is it actually quite nice to be able to give that messaging after months of not being able to let people come back?
Yeah, look, we did what we could do during that really high peak demand to try and relieve some of the pressure for those really genuinely urgent and emergency compassionate cases. But it was a frustration and I think a real challenge not to be able to let all the New Zealanders who wanted to come home within the time frame that they wanted to come home because of the demand for managed isolation. So it is comforting to know that those Kiwis who need to return home now can do so. In fact, The teams who deal with emergency allocations have actually been saying to people, you don't need to do this. Just jump online, you can book a voucher now, it'll be quicker doing it that way. And that's a nice position to be in, obviously.
Are you pleased with the uptake of the vaccine by Māori and Pacifica?
In terms of uptake, yes. I mean, we're not seeing any hesitancy, or I haven't heard reports of hesitancy rates there that are any higher than anywhere else. But the statistics, of course, reflect in that Tier 2 group, they do reflect the makeup of the health workforce, which has an underrepresentation of Māori and Pacific workers within it. That's something the health system, I know, is focused on and working on, but for now, in the vaccination statistics, it obviously flows through.
Vaccination.
We'll come up the back here.
Just a question for Dr. Bloomfield. Just on transparency of adverse reactions, can you just give us a bit of information around why it wasn't proactively released about the 2 people who died thought to have been from unrelated causes, but they were reported to the Centre for Adverse Monitoring?
Yes, so this is good practice, that any death that occurs within a period after a vaccination, and of course this occurs anyway in the health system. If someone dies within a period of 28 days having been in hospital, that is reported and looked at. So in this case, these deaths had just been reported to CALM. And of course, in a situation like that where you've got grieving families, it's good the report has been made, but we would want to wait until the medical assessors had had a chance to look at those deaths and determine if there was any likely link to the vaccine. And in fact, there have now been a total of 3 such deaths in older people within a period of a few days or slightly longer after that vaccination. They've all been looked at by the medical assessors, and that their assessment concurs with those of the clinicians who were treating the people, that their deaths were not related to the vaccine.
The vaccination data from DHB shows that in 7 cases they've widely kind of overshot the mark for what their plan was. In a couple of cases, 150, 160% of their plan. In a situation where there's constrained supply, is that kind of concerning that they seem to be unable to adhere to their plan, even though it might be seen as a positive?
Look, frankly, I'd rather it that way than the other way. Ultimately, it may mean that towards the end of June, we have to slow down for a little bit. We're not talking about slowing down for a long time. It may be days, it may be a week or two, until we start to see big deliveries coming in. We are getting supplementary deliveries, if you like, over the next few weeks. They tend to be small, so we are certainly delivering more than we are receiving at the moment, running down that stockpile that we have, which is, it erodes away by the day, and we fully expect to be through that by the end of June. If we get through that by mid-June, then yes, we will have to slow down for a period. But I think what it shows is that DHBs are eager, they're ready to ramp up. That's a positive sign for when we really have to ramp up further from the middle of the year onwards.
One of your concerns all along is you've been saying you want every week to vaccinate more than the previous week, yes, so that there isn't that kind of a bump. So if there was a slowdown, would that require standing down vaccinators?
I mean, many of these vaccinators, many of the people doing vaccinations have other jobs. They have a primary job. They are doing this, and they will have other things that they can do. I'm confident that the people who are managing that will be able to manage that. In some cases, if there's an opportunity for people to take a breather for a few days before they get into the really big scale up, that may well prove to be timely. But I know the teams are working very hard to try and smooth that, so we can avoid as much as we can the need to scale down and then scale up within a day, days or a week or two. But the fact that we're doing really well does increase the possibility that might happen.
Can you remind me how big the stockpile is?
We'll come over here.
Can you remind me how big the stockpile is?
About 350,000 as of, I think, late last night. We've been getting deliveries in the vicinity of 60 to 70,000 now. Obviously, per week. We're obviously delivering more than that now, and so that number drops down week on week, and we expect that will continue right the way through to the point where there's next to nothing left by the time we get to the end of June. Then, from July onwards, we do start to see big numbers of vaccines coming in. That delivery schedule's not 100% locked down yet, but indications from Pfizer are that they're confident that they will be meeting, they'll be able to scale up for us in terms of what they're delivering to us, and the relationship there is very good. What we know from Pfizer is that when they say they're going to do something, they do it, and when they give us certainty around delivery, then we can bank that.
The situation in India created some of that uncertainty or added to that?
That's not where our vaccines are coming from, so it hasn't added to any concern at our end. That's not the feedback that I've had. But.
No, Pfizer's delivering exactly the volumes that it committed to, very regularly, very reliably. There are a couple other things that are happening, and we discussed this yesterday in our internal steering group around us working with the DHBs just to get that match between the supply and demand. There's a big difference between a very small DHB delivering 150% of its target and say our Auckland region. So we're working very closely with all the DHBs just to get the balance right. What I would say too, again, as we gain experience, we're finding that from some of the vials, some of our experienced vaccinators are now able to get up to 7 doses as well. So that's so we're doing all these things to maximise the amount of vaccine that we can deliver between now and the end of June.
So just to clarify, we have sought assurances from Pfizer that the supply that we've been promised from July the plan is still to receive them, and there's nothing happening around the world that is affecting that.
They haven't indicated any concern about that to us, nor have the team who are regularly talking to them. What I would say, and I'll just repeat what I said a moment ago, Pfizer have been incredibly reliable in honouring the commitments that they've been making. They've been cautious about making sure that they're not over-committing themselves, so that when they do lock in a commitment, they stick to it. And all evidence that we've had so far to date is that they have been incredibly reliable.
So one of the underpinning factors of the Australian budget is that international travel isn't due to forecast to resume in Australia until mid-2022. When does New Zealand forecast international travel coming back online?
Look, I think we have to say that we're unlikely to see significant volumes of international travel beyond safe zones in this year. And possibly early into next year. I mean, I think Australia's modelling is probably quite sensible in that regard. I've always said that I think that international travel won't just be a sudden, flick of the switch moment where all the border restrictions come up. It'll ramp up slowly over time, and we will take a risk-based approach to considering those. So that may include opening up to a broader number of safe-ish countries earlier. Vaccination may play a role in that too, but at this point, I think what we've said is that this year, unless you're talking safe zones, don't rely on people coming in from other countries without doing that 2 weeks of isolation on arrival.
A couple of different dates or periods then. So you imagine it'll ramp up from the start of next year, is what you're saying?
I wouldn't necessarily say that. At this point, we just don't know at this point.
What are you doing?
I'll come over here.
Given the low numbers of Māori getting vaccinated in Tier 1 and 2, and you couple that with the poor health outcomes, do you think that there needs to be a bigger push, I suppose, to get more Māori vaccinated?
It's something that I've had a conversation with Andrew Little about, and I know that it's very front of mind for him as Minister of Health, is the fact that Māori and Pacific people are underrepresented in the health workforce. I know Dr. Bloomfield and I had conversations about that when I was the Minister of Health. It is something we need to do better on, and we're seeing that in our vaccination statistics. Absolutely, as we move into the broader, wider population groups, we do need to do a really good job of targeting Māori and Pacific communities to make sure we're getting those vaccination rates up. That involves working with Māori and Pacific health providers who are trusted in those communities to make sure that they are playing as much of a role as we can have them playing. It means making sure that the role modelling that we have people doing reflects the communities of New Zealand. And you'll see evidence of that. We've had some of our kaumātua lining up to be vaccinated in front of a whole lot of cameras. I can tell you, having done that, it's not an easy thing to do. But again, it sends all the right messages. So we've got to do better. There's no question about that. I think as we start to move into broader population groups, and not just the health workforce, which has been a heavy emphasis so far, I think we will see those numbers starting to shift. But I'll ask Dr. Bloomfield to add to that if he wants to.
Just one other comment is that it's a standing item that gets a lot of discussion in our internal group and also our governance group, external governance group for the program. And DHBs are under no illusions and I think very committed to ensuring that they have very specific plans in place to reach into those communities. And we will be, what they have also asked us for is specific numbers based on their population in each group that population numbers that we would expect them to be achieving over a period, and so that they can lock that into their plans and ensure they are delivering to that.
All right, we were having so much fun that we've run 5 minutes over time, so I'll allow 2 last questions here and here.
What are you doing to get the numbers up in Northland? They're still trailing by quite a lot. They're trailing a lot less, but still 79%. when most other DHBs are doing, high 90s or over 100.
Can I just make a comment about that? Northland were incredibly ambitious in their targets that they set for themselves. If you look at how Northland's doing compared to other DHBs around the country, they are delivering a lot of vaccines. They were very, very ambitious in the target that they set, and I congratulate them for that. And they've actually started to move much closer to their targets than they were a week or two ago. So I don't have any criticism for Northland. I think they're working at speed to try and deliver ahead of, on a per capita basis, what many other DHBs are doing, and I think they deserve credit for that.
Have we identified any other places around New Zealand where vaccine hesitancy might be higher, and do we have any sort of plan to address that? Golden Bay, for example, or West Coast and South Island, areas like that?
Yeah, there are some locations, and in fact Northland is one where their childhood vaccination rates are lower than other areas around the country. Yes, we know there is a particular dynamic on the West Coast, and also, as you've said, Golden Bay. Look, those DHBs will be working specifically with communities there, and Northland, as we've just discussed, and it's good to see actually their numbers of Māori coming up, particularly in this last week, who have been vaccinated. They will have specific initiatives in place to try and reach those populations that might otherwise not come forward actively, and that they'll see that as a key part of their job.
The hesitancy that the surveys have shown, roughly around 30%, does that basically mean that whether we reach population immunity eventually is in question, and what implication does that have for opening our borders? If we are below population immunity, when we do open our borders to other countries where there are high rates of vaccination, do we just accept that it's
If I could make a general comment on that, I don't think vaccination hesitancy now is anywhere near at that kind of level. We did know that in the early stages we saw some hesitancy based on people saying, well, this is quite a fast process, these vaccines have come online quite quickly, is it safe? We're seeing a lot of that eroding away. In other countries who we're monitoring, who have been rolling out their vaccinations quickly, they have found that vaccine hesitancy has reduced as the broader population has been covered. And I fully expect that that's what will happen in New Zealand as well. All right, thanks very much, everybody.